Hey everyone! Alright, I've gotten quite a few requests in my Bath and Body Works haul. I mentioned that I was going to do some health videos, basically just some videos about, I'm a clinic screener at my pharmacy, and what I basically do is I test for a couple things, like most of the things that you like when you go to the doctor's office and they test your lipids, like which is your cholesterol, your liver function, your hemoglobin, your A1C, like all those tests that you get done at your doctor's office. My pharmacy also offers them at a like cheaper price. You don't have to have an appointment, or you have to have an appointment, but like you don't have to have insurance or anything. We just charge you like a flat rate for it, and then you get your results within like 5 minutes. So I decided I would do maybe like a series of videos basically telling you kind of like what I do and giving you some information that like you might not know about different um, like the different tests and like what they test and like why it's good to get the tests and blah blah blah. So I'm going to kind of give you an overview of basically what the next few videos are going to include. So at my pharmacy we offer a full lipid profile, which basically tests your total cholesterol, your HDL, your LDL, and your HDL is your good cholesterol and your LDL is your bad cholesterol, and your triglycerides. Generally before that test you want to fast 9 to 12 hours before, which generally means you can just drink water, but no eating or anything. And you can also take any medication that you're on, but you don't want to eat any breakfast or anything, because sometimes it does affect the test. Actually, it does affect them. Not sometimes, it does affect it. And that's why we ask you to fast. So that's the first test that I do. And I do these clinics at least, they're supposed to be once every month, but this month, July, I'm doing one on the 2nd, which is this Friday, and then one again on the 30th. And my clinics are so full. Like all the other stores, like all our other pharmacies, do these clinics as well, and theirs are nowhere near as busy as mine. So I don't know if I'm just like a little bit more likable. I don't know. Or maybe people feel more comfortable coming to my pharmacy and like getting it done. I'm not sure why, but like the girl that I talked to, that's her store is just down the street from ours, she said she doesn't even have anybody for this week. I already have 10 people. And most people that come to my clinics get the full lipid for sure. Like that is like the number one test that I do. Then following is the liver function, and then usually an A1C test. So I'm going to go on and kind of explain those tests to you now. We also do a simple cholesterol, but if people come in and say, I want to get the simple cholesterol and the full lipid, well, I'm not going to give you both, because I'm going to try to save you some money by just telling you, like letting the people know that the full lipid test, which tests all of your cholesterol, like your total cholesterol and then your HDL, it breaks it down for you. It's better to just get that, because I can tell you what your total cholesterol is in that test, opposed to spending another $10 just to get the simple cholesterol, which that one only measures your total cholesterol, and you don't have to fast for that because it's not as detailed. It's not telling as many things. So the next test that we offer, that I do a lot of, is a liver function test. And basically a liver function test, what we test for is the ATL and the AST levels. And as I tell you more and more about these tests, I'm going to break down what each thing is and what we're testing and what it means and everything, because I'm just going through an overview right now, because there's a lot of details in it, and I know a lot of people don't know what all the testing is, so I'm going to try to explain everything when I do a separate video for each specific test. So I'm just kind of going through an overview and throwing out a bunch of words right now that you might not be familiar with, but I will cover them in future videos. I'm just kind of giving you an overview in this video. Anyway, so we test the ATL and the AST levels in your liver, in the liver function test, which is just, I'm not going to get into what it is because it'll take forever. Okay. And you don't have to fast for that test. And it's usually good for people who are on cholesterol or other medications, just to get tested, for that. Also, we do a hemoglobin test, A1C, which is basically your blood sugar average over a 3-month period. or within 6 to 10 weeks. I think it kind of ranges between, generally falls between like 90 days or 6 to 10 weeks. It's recommended for diabetic patients to get this every 3 to 6 months, just to keep an eye on what your sugars are. My husband's diabetic, so it's good for him to kind of just figure out where his sugars are falling. And it's nice to do it over a 3-month period, because then you can see if your sugars have been higher or lower than what they normally are. So it's a great test, and it literally takes like 3 seconds. I mean, it's a prick of the finger. All these tests I do by just pricking the finger and then drawing a small sample of blood, and then testing them in the machines, which I'm going to show you all that stuff in future videos, so please bear with me. Okay, so you don't have to fast for the A1C test either, because it's just testing you over the 3-month period. So and then the next test that I offer is just a basic blood glucose test, which is just like when you see those diabetic meters. It's just a quick prick of the finger and letting you know instantly what your sugar is at that moment. You want to take your medication and drink water as normal. You do want to fast before this test, because that's going to give you more accurate, opposed to eating a sugar-filled breakfast. Of course your sugar is going to be high, or when you don't eat, it kind of gives you more accurate test results for that. Just measures your blood sugar at the time of the testing, which is instant. You got to fast 9 to 12 hours before the test. But those are the basic tests that I offer. And I don't know. Yeah, like that's it. So what I'm going to do is I'm going to break down the next videos into basically what is your cholesterol. I printed everything out so I could explain it to you really well. I mean, I know what I'm talking about because I do this every week or whatever, a couple times a month. It seems more because I do have to travel to other stores sometimes. I'm going to break down what your HDL is, your LDL, and all that things as well. And then I'm going to kind of give you some ideas on what you can do to reduce your, to bring your LDL down and take your HDL up, and everything about that. I hope this video is not too confusing for you and I'm not too all over the place. It's hard to kind of explain everything in an overview video and then to break each one down, but that's what I'm going to do, because it's just going to be the most reasonable way to do this, because there's a lot of information and it can be overwhelming and really boring if I just talk and talk and talk and then you're like, oh, what is that? What is this? So that's basically what these videos are going to be about. I hope you're interested. I've had quite a few people inquire about it and make some comments about it, so I just threw it out there, you know, just to kind of give you an idea. It's good to share when you know stuff, and a lot of people don't have health coverage and they can't get to the doctor, and it's awesome that our pharmacy offers this to people who don't have the insurance. And these are I use the exact same machine and the exact same testing that they do at the doctor's office, so it's very accurate and it's very reliable, and you can take the test results that I print out for you and give to you and take them right to your doctor, and they're completely something that they can use to compare and help you out. So I hope you will stay tuned for the videos. I know this is a beauty kind of channel, but it's actually kind of a life channel. I'm going to try to keep it where it's a little bit of like beauty stuff and then health stuff and then, you know, everything else that I'm interested in. So I hope you enjoyed this video. I know it's kind of all over the place, but please stay tuned for future videos that will have a lot more information. Thanks. Bye.